welcome Franco Versesi from Italy, who is an elegant plastic surgeon and a very good expert concerning this resorbable suspension. And he will have now something like 20 to 25 minutes to make both demonstrations. Number one, insertion of threads, and number two would be some complementary injections of hyaluronic acid he will present in a while. So, hello, Franco.
Hi everybody, can you hear me? Yeah.
We are very happy to have you. So everything is okay. So I would like to recommend you the following. Number one, you have to analyze the patient.
Yeah.
Number two, you have to make some drawings just to present on a very clear situation what you propose concerning the level of insertion and the point of entrance and everything like that. And then, of course, you can begin. And I have to explain you that when you will be on one area, I will stop you and you have not to move. And Philippe will present you exactly the same on the cadaver. So it's a little bit a special exercise you need to understand. Don't move. I will stop you when you have the insertion in one area. Thank you.
Okay, perfect. Thank you, everybody. So first of all, analyze. This is a combined treatment. The patient has been already injected with LNC a few weeks ago, and we had the volumization of the temporal area. We had the reshaping of the chin, all the reshaping of the jaw and the mandible area. Now the purpose is to use 3 threads, 8 cones, to give a support in this direction to the jaw, to create a support and a volumization of the mid-face in 2 directions. These are the vector where we have to work. At the end, I will check the marionette line to improve with injection of Perfecta, and I will work also very superficial in this kind of wrinkles on the wrinkles of the area between the eyes. So it's a very combined treatment. And after the first step, after the analysis, the first step is to start with the thread. So the first is to volumize the cheekbone area. Always I use the technique classic. I stretch, I enter a little bit, I grasp, and I go a little bit deeper. So I ensure I am in the right tissue, just a few millimeters under the skin. You remember the black tag? I stretch again, I enter just a little bit in the right plane, I turn, and I move in the right plane, just to the exit point. Thank you, Rosalba. What a privilege today to have a Madame Suture to help me. I enter with the second one.
Stop. Where are you exactly? And just explain now the very important tip you need to explain concerning the entrance of the needle, please.
The very important tip is the deepness. Yes, because if you stay...
But your entrance, it's perpendicular during 5 millimeters.
Always. The entrance is, you create a hole very perpendicular, like a well. You enter inside without to touch the walls of the hole. And after, when you are at the right deepness, that is more or less 6 or 7 millimeters in the Caucasian patient, a little bit more in the Asian, you turn. You create this bump. This bump, it means that you are at the right plane. This is the area where we have to run. You see, I grasp the tissue just before, just to create like a channel when I can really pass without any effort. And I use the cap to be sure index. You see, if I lift,
yes.
I always give a traction in the horizontal way, and after, this is done. This is very important because I want to obtain the projection over the cheekbone.
Okay. So, Franco, stay like that.
Yeah.
And just, no. We need to have the vision of the patient, yes. And now, Philippe, could you explain exactly where Franco is?
I am in the subcutaneous tissue, just over the mid-face, the cheekbones, and towards the zygomatic arch. In this area, if you stay in the right plane, is very safe. You see, if I lift.
So when you inject and you introduce your needle, you're in that plane. So I introduce in this fat, and then so below the skin, the normal plane is the malar fat pad. This is the internal plane where you have to introduce your needle. And you see that you can make the dissection and you can remove the fat only with this needle because you're in this plane, in the superficial plane. Never be too deep, because if you are too deep, you will cross the muscles. And there's no action if you're too deep, because muscles are stitched on the bone. So the normal plane and the safety plane is this plane of superficial fat. And then the skin will follow the action of your threads.
Perfect. I will go ahead because here the second thread is in the same plane and in the same area. So I make my hole perpendicular. I insert.
Je me donne d'autres fils, mais c'est bon, je l'ai.
You see the direction. Always I grasp and I check with the snake movement or Rosalba. I check the deepness and the uniformity, and I enter with the thread.
Remettre la peau en place, ils sont gentils. Ouais, mais c'est pas grave, c'est juste pour...
I do the same with the second one, and I move upward.
Après, il va remonter vers la pommette.
Voilà. Here is not so interesting to show anatomy because it's the same area where I inserted the first one. The third one is on the jaw, and is one we use. Why we grasp? If you see, I stretch when I enter a little bit, and after I grasp to be sure not to go too deep.
Non, ça suffit. On aurait pu mettre des fils en dessous. Oui, je sais, mais ce que je veux dire, c'est que... Voilà, fais-le là. Alors maintenant, on peut le faire plus bas.
I stretch the skin, I enter, I grasp, I go a little bit deeper, I turn, I see my bump, I see my snake, and I go out in the subcutaneous tissue. When I lift, you see very well that I am in the subcutaneous tissue because you see the thickness of the skin is very uniform, and the skin move with the subcutaneous tissue, because if you stay too deep, you cannot move the skin.
Okay, could you insist a little bit about what you would like to recommend concerning the supra insertion with much more dedicated to the fixation? Anytime it's important to see exactly where is the threads concerning the insertion inside the superficial fat. But what about the fixity? And just explain how you can have a certain level of fixation concerning the upper part of your insertion.
Okay. So first of all, remember the concept of the opponent's cones. Opponent's cones works in both the direction. So for example, this one works creating a traction in both the direction, creating a volumization of the cheekbones and the mid-face. But for example, this one, you have a looser part here, where the cones work creating a traction in this direction, and a more hard part here. Here, the skin is a little bit more fixed to the deeper plane. So we can use this part and this part that are more fixed to create the resistance to the traction we give in the looser part that is in the inferior part of the jaw. This is very important because the difference is that when you use the cones in the opponent way, you create a stronger fixed part here, but it's a fixed part that is able to move with the skin. It's not a fixed part as, for example, other kind of threads where you have a technique with a very rigid part that when you open the mouth, so you give a strong traction on the skin. In this case, also if I give a strong traction, also if the upper part is a little bit more fixed, I still have some movement. So the result during the time is much more long-lasting because it's much more natural and the skin can move in a more natural way with the movement of the muscle on the skin. Understand what I mean?
Yes. So I think it's something we make sense. So now, in summary, we know that we have to make the insertion inside the superficial fat, which is absolutely crucial. And number two, thanks to Philippe, because Philippe showed us the danger zone. So could you repeat, Philippe, just the danger zone to be absolutely on the good target concerning a clear summary? The danger zone for any insertion of the thread.
Okay, thank you, Benjamin. So to summarize, the danger is when you dip, when you too deep. It seems easy in that case because this is a fatty person. And in the fatty person, it's very easy to find the subcutaneous fat. But be careful when you use threads for a very skinny person. Be careful to stay in this subcutaneous fat, even it's very fine sometimes, because if you're too deep, the danger here is to be below the muscles. You can cross nerves, you can cross arteries, you can cross the sternum duct, you can cross all the problem when you deep and without any action because there's no possibility to elevate the deep plane, it's stitched on the bone. So safe is superficial, but not too superficial because if you just below the skin and too superficial, you will see the thread through the skin. So you must be in the deep subcutaneous plane. But subcutaneous, I insist. Subcutaneous, you must be in that plane, in that fat.
That's the reason we don't recommend, if we have some atrophia concerning the superficial fat, to have this sort of indication and treatment. It will be risky, right?
I'm agree. Yes,
okay.
Benjamin.
Okay, so Franco, I think if you can make some elevation of the patient and put the patient a little bit more perpendicular, we will see exactly the difference between the left and the right.
Now I didn't put the traction. So now I put the traction.
Okay, so let's focus on your traction.
Yeah. You see, I move. Have you seen the movement of the jawline, of the cheekbone? Okay. and I create a traction also on the jaw, a little bit too much, and a traction. Okay. Please, Corinne, can you?
Yes, yes, yes. Okay.
Now you see the correction.
Okay, okay, okay.
Okay.
So that's perfect now.
Okay.
Perfect. Yes. Okay. So, Franco, just a little summary, but we are going to have some questions. So I recommend the audience, for the people who would like to ask some question, to go to the microphone and stay close to the microphone, please.
Okay.
And, okay.
What I suggest when I give the traction is not to overcorrect, just correct, because the suture are not a substitute as a lifting, as already we discussed, no? But it's an excellent support, because now my objective is just inject a little bit of perfetta here, here, and here on the right side. So you can see the right side.
What is the HA you would like to recommend concerning the range of perfecta? Is it a classic one? Is it a light one?
No, here I will work with the deep, because I want to give a little more support. But in this wrinkle, I will use the component very superficial intradermis, because here, if I stay deep, I stay near the arteries. I don't want to dance with the tigers. And here, I already injected deep with LNC, so the correction of the volume is okay. I just want to correct a little bit the memory of the wrinkles.
Okay, so
is a touch-up.
Okay, okay. So, Franco, it was absolutely super. And thank you for your very nice demonstration. And thanks, Philippe, of course, concerning everything dedicated to the anatomy related to this topic. So now could we switch on the light? And I think that that's the moment for you guys to have, if you have some questions. So please, don't be shy. And I'm sure that you have some questions for these two experts. I think that is something, of course, which is quite interesting to share with you. Do you have a clear vision about where you have to insert the threads? So that's something will make sense if you have any hesitation. So no one question. I can see that everything seems to be okay. So it's the moment now to thank our company with Sinclair. Yes, yes, madam. So Sinclair make for this 1 hour session an unrestricted grant, and thanks to Sinclair, who is the sponsor of this hour. So please, madam, yes, if you have a question.
About the threads, I just wanted to know, are these rules apply for the PDO threads as well? The same plane?
Yes, madam, absolutely. You will, I will recommend you the next session dedicated to the techniques, but it's exactly the same level concerning the PDO. And I recommend you the session we are going to have during the afternoon, which is going to the analyze of all the threads. We call that the product analyze session dedicated to the threads. So I will recommend you that in a while. So now it's my pleasure to go back to Surabaya, if Surabaya is ready. And of course, yes, madam, very, very, very last question, please. Go back to the microphone.
I saw you, he make the 8 cones straight technique. All the technique he made here is straight technique. Why he didn't choose to make the 16 cones with one opening?
Okay, so it's a question for Franco. Franco is with us or not?
Yes.
I think okay, Franco,
I can explain why I didn't use the 16 cone with the U on the V technique.
Please, Franco.
I want to use the concept of the opponent cones. Opponent cones, it means that I create a fixation just under the skin, between the soft tissue. I don't create a fixed point. This is not aptos, just to use the term, the right term or the other threads. This is not a lifting, this is a support. And this is a support that must be as much long-lasting as possible. If you use the technique with a fixed point, like for example a V technique here, when the patient opens the mouth, all the traction is on a small fixed point. So what happens? you move. If you create the traction along the two directions on the threads, when the patient opens the mouth, the threads move with the mouth, with the skin. This is why I prefer to use the linear, the angular technique than the U, the V. Sometimes I use the U, but in a very dedicated indication. So after depends on your experience. But in this case, I think that 16 cones is just to save the money of your cones.